Guys, if you know you're here, even if you're a young girl, or you know that your wedding is in few months, or you know very well that you're preparing yourself for pregnancy, or you're in your husband's house and you're struggling to get pregnant, please, I advise you to go for this fertility test. Now listen, going for fertility test does not mean that you must wait till 1 year before you're going for this test. You can actually go for this test to know if you have issues or not. Do you understand me? Now listen, what are these fertility tests we're talking about? This test will indicate if you're having any issues, so that you can start your treatment early, even if you're not married yet. The earlier the better for you. Now, what are these tests? Number one, we're talking about what HSG, which means hysterosalpingogram. This test is to detect if you have any tuber blockage around your fallopian tubes. Ladies, listen to me. If you have fallopian tube blockage, you will never know that your tubes are blocked. That's the truth about it. No sign that is indicating that what you have tuber blockage. It doesn't stop you from ovulating, neither will it stop you from having irregular menses. But the problem there is that you can't get pregnant even when you're ready to have a baby, because you have fallopian tube blockage, especially if we're talking about the bilateral tuber blockage. Okay. Number two, we're talking about pelvic examination. This test will detect if you're having any issues in the body, for example, fibroid, adenomyosis, polyps, you see, and other signs, ovarian cysts, polycystic ovarian syndrome, other signs. This test will actually detect it if you're having issues like that. Now, if you have issues like that, relax. You start your treatment early, and then you get your result. Okay. Number three, we're talking about what hormonal profile test. This test will detect if you're having an imbalance in your hormone. You see, with this test, they are going to check if there's problems like hyperprolactinemia, PCOS, as a result of excess androgen hormone, low AMH, high AMH, other signs, polycystic ovarian syndrome. These things diminished ovarian reserve and other signs. This test will actually detect if you're having issues like this. So the earlier the better, my sister. Go for this test. Now, for your partner needs to go for what? Semen analysis. Listen, when we talk about infertility, 1/3 of infertility can be from the man, 1/3 from the woman, and 1/3 is what? Unexplained infertility, because you don't actually know what is happening. You see what I'm saying? So please, kindly go for fertility tests. It is very, very important. If you're not married yet and you're preparing to get married, please go for fertility tests. If you're here, you're preparing to have a baby, you can go for fertility tests. You see, it is very, very important. Thank you and have a blessed day. Bye.